We know a lot of patients are on the fence about whether or not to come into our practice or not, and that's fine. This is a very tough field to choose someone to be your practitioner. So what we want to do is kind of explain to you the difference between what you're going to get at our office versus the traditional care, right? When you go to the physical therapist that covers your insurance, we already know what you're going to get. You're going to get some sort of heat, some sort of stim or ice or whatever, some sort of modality where you lay there, and then you're going to get some generic exercise that they're going to be with you for maybe the first couple of weeks, and then they're just going to let you go on your own and just go over and practice. And for some people, that works. For a lot of people, it doesn't, because it's not specific enough. The same thing with your insurance chiropractor. Yes, the copay is very low, but understand they're not going to be very rigorous with their evaluation of you, because what they're really looking to do is adjust you. And maybe they'll give you some cookie cutter exercises, and maybe they'll give you some heat, but overall, that's what you can expect. And again, if you just rest, you're going to get better with each one of those things. What we're looking at here, understanding that most of our patients have been in pain for more than 6 months, they've been to 3 other practitioners before they found help with us. And that's because what we do is different. We recognize that each case is very specific, but also recognize that there are very standard principles that we need to respect when it comes to treating the human being. So what really we do when you come in is, in that first hour, we want to really understand what is exactly wrong with you. What tissue is damaged? Why is it damaged? How damaged is it? And we seek to give you those answers within the first and second visit, because we want to let you know if we can help. Right? We can't help everyone, and we recognize that. So we don't want to waste your time or money, and when we realize we can't help you, we're going to move you on to the person who can. The other thing is that we're realistic in how much we can help you. Listen, we get a lot of people in here who have been dealing with pain for decades and have a ton of degeneration, and guess what? 100% recovery is not likely, but maybe 70% is. And we're also going to be very honest about that. The other thing that we do here as well is we tell you what you need to do to get well as quickly as possible and as really achieve maximum therapeutic benefit. A lot of times creating a nice metabolic environment for your body to heal in is a huge part in recovery that is not talked about in the other insurance PT and insurance chiro models, because guess what? They don't get paid for it, so they don't do it. So that's just a little bit about how we work differently. We're very specific. We treat everybody as their own individual, and we're not giving cookie cutter treatments. We're spending the time to figure out what's wrong with you and figuring out the exact plan that you need to be successful.